welcome you all in this module of Panchakarma, and today in this today's lecture we will discuss the fundamentals of Abhyanga. I am Dr. Rajkala Patil, Associate Professor and Head of the Department of Panchakarma, Faculty of Ayurveda, IMS BHU. As we know, the Abhyanga term is ideally the Ayurvedic therapeutic massage. It's not a spa massage. There is a difference between parlor massage and our Abhyanga. It's not a thigh massage also, and it's not the thigh massage also. There is a scientific way of doing the Abhyanga, and in today's lecture we will discuss what is the classical references of Abhyanga, where it is indicated, where it should not be done, what is the SOP of Abhyanga, and what are the classical importance of Abhyanga. It's not a massage, it's a Ayurvedic therapeutic massage, or it's a treatment. Usually we do it in the healthy also or in the diseased also. So it involves the Abhyanga, involves the applying sneha dravyas. It might be oil, specific oil, or it might be ghee with gentle pressure in specific direction. The Abhyanga can be administered to the entire body or to the specific areas. When it is done in the entire body, it known as a Sarvanga Abhyanga, and when it does to the specific part of the body, it known as a according to that part. That is the Shiro Abhyanga when we do it to the head, Karna Abhyanga when we do to the ears, face Abhyanga or like Mukha Abhyanga, Pada Abhyanga, Hasta Abhyanga. It can be named according to the organ. In many modern massage techniques, they have their roots in the Ayurvedic Abhyanga. It influenced by the many massage techniques are influenced by the practices like Keraliya Kalari Chikitsa, Kathakali massage, and martial arts also. They all have the roots in the Ayurvedic classical massage. There are the different types of massages, including hygienic massage, sports massage, and therapeutic massage. It serves a distinct purposes in the wellness and the healthcare. So in today's lecture we will discuss the classical Indian therapeutic massage. Coming to the importance of Abhyanga, just as in text or in Charak Samhita, it has written like Sneha Abhyangat yatha kumbha charma sneha vimardanat bhavati upangat akshascha drudha klesha saho yatha tatha shariram abhyanga drudham sutvakam cha jayate prashanta marutam abadham klesha vyayama samsaha. Like just as a pot, leather and axle of a cart gain strength and efficacy through oiling, so too does the body become robust and resilient, while the skin attains a firm and healthy quality when regularly anointed with oil through Abhyanga. Or Abhyanga pacifies the Vata dosha, enabling the body to endure fatigue and physical exertion effectively. That's the clinical importance of Abhyanga, and that is the importance, like Charak also says, like if a person who regularly perform Abhyanga or oil massage has well nourished skin and a strong attractive appearance, and they ages very slowly. That is like bhavati Abhyanga nitya naro alpajara evacha. There are the special effects of Abhyanga. The hair does not turn grey, nor does it fall if the person do the routine Abhyanga. The strength of the head and skull specifically increases. The hair becomes firm rooted, long, and the black. The sensory faculties becomes pleasing and one attains a youthful appearance. The gain of sleep and happiness happens through the application of oil on the head. And in benefits of Abhyanga, Vagbhata also says, Abhyangam acharit nityam sajara shramavataha drushti prasadam pushti ayu swapna sutvak dardhakrut. If Abhyanga, or routinely he says, Abhyanga should be incorporated into our daily routine because it offers numerous benefits to the human being. It slows the aging process, reducing the exertion and calming Vata dosha. It enhances the vision and eye health, providing nourishment to the body, promoting overall well-being, contributing to the increased longevity, improving the quality of sleep, promoting healthy and radiant skin with improved complexion and firmness. It also enhances the physical fitness and vitality in the human being. And Sushruta also says like massage creates a softness in body, pacifies the kapha and vata, nourishes the tissues and imparts the healthy, soft and radiant complexion. So, in classical text it is written that there are the special sites where we should, it is very essential to do the Abhyanga, that are the Shirashravana Padeshu, like for head, ears and feet. It is very essential to do the daily Abhyanga. At least who cannot practice the whole body massage, at least these avayavas should, or these organs should undergo the daily routine Abhyanga. It is like in some culture also the Abhyanga culture is there. In south part of India usually we find like daily in every families before bath they usually do the Abhyanga, and on the day where they cannot do the Sarvanga Abhyanga, at least for the head, ears and feet they usually do the Abhyanga. So, this is the cultural practice and it should be there in all part of India or wherever a person live, the daily Abhyanga is must needed. The benefits of Shirobhyanga, it helps to prevent the head related ailments, it promotes the growth of soft, long, thick, glossy and dark hair, it provides a sense of contentment to the head and it diminishes the facial wrinkles and it nourishes the sensory organs and enhance the overall head vitality. Selection of Sneha for Abhyanga. In case of body constitution, season, time of day and place being affected by defects, one should use oil or ghee for the practice of Abhyanga. It is not necessary to specify the Sneha for everything. As we know, like in our daily routine also, as a part of India it changes, the choice of ghee also, Sneha also changes. Like in south part of India they mostly use the coconut oil for everything. So, for them or for the people from South India, the coconut oil is the specific or routine Sneha for the choice. In the north part of India where they routinely usually they have the mustard oil in their diet or mustard oil for routine. So, for them mustard oil is the choice of Sneha for not only for Abhyanga, for other therapeutic uses also. So, mustard oil can be the choice of drug. Or in the middle part of India where they usually use the groundnut oil or tila taila. So, tila taila can be the choice of oil or Sneha for the Abhyanga. And in body constitution also, if the body is having pitta predominance, mostly we prefer the ghee. In the summer season, if the pitta predominance is there, so in that coconut oil also can be used in the season. When it comes to the season, if it is a cold season, of course coconut oil or ghee cannot work, there we have to go for the mustard oil. And if the day of time, if it is the cold day, cold season, of course mustard oil will be the choice of Sneha, and if it is a very hot season, coconut oil will be the choice of Sneha. And place being like place, if we are practicing in Delhi in the cold season, of course we cannot take a ghee or coconut oil, there mustard oil will be the choice. So, the selection of Sneha will, this is for the normal person Abhyanga. When it comes to the deceased, of course we have the different choices, selection of oil. So, if the Vata dosha is involved, we can go for the Prabhanjan Vimardan Taila, Vata Shani Taila, Dhanvantaram Taila, Narayan Taila, Mahanarayan Taila, Dashamul Taila or Nirgundi Taila. Though the patient is having osteoarthritis and he is having pain, but if it is the of the Vata predominance, we should go for the Dashamul Taila or Nirgundi Taila. If it is having the predominance of dosha is also very important for the deceased condition. When there is a pitta predominance, we can go for Kshirabala Tail, Pinda Taila, Chandan Bala Rakshadi Taila or Nalpamradi Taila. If there is Kapha predominance, we should go for the Kottam Chukadi Taila, Sahacharadi Taila, Dhanvantaram, Sahendavadi Taila. And when it comes to the disease, there are different diseases in classics where we are using the different oils. So the disease specific oil is always a proper choice for the Abhyanga. That only makes this Abhyanga very unique from the other practices of the massage, because they usually take the simple aroma oil or simple plain oil where this petroleum jelly or petroleum is added. So that is not work as a Abhyanga, or that is not work as a Ayurvedic therapeutic massage. So here are the diseases and the particular oil. As in Amavata, we use Amavata is a condition where Ama and it's a disease where Ama is vitiated with the Vata and creates the autoimmune disease. So in such conditions, whenever there is Amavastha, we go for the Sendavadi Taila or Narayan Taila. When there is a Sandhigat Vata or a kind of osteoarthritis, we go for the Mahanarayan Taila, Panchaguna Taila, Dashamul Taila or Nirgundi Taila. Whenever there is a skin disease or Kitiba like psoriatic arthritis or psoriasis, we go for the Ayyapal Kera Tailam, Eladi Kera Tailam, Marichadi Tailam. And when there is a Pakshaghata or neurological manifestation is there in the disease, for the Abhyanga we can use Mahamash Taila, Vishagarbha Taila or Mahavishagarbha Taila, Prasarini Taila, like that we can use. Whenever there is the involvement of muscles or Mamsakshaya or the diseases of musculoskeletal system is there, we will go for the Bala Taila or Niramish Masha Taila can be used. So coming to the procedure details, the materials required as shown in the slide, there are the oil, medicated oil. If we want to do the whole body massage and patient is of medium build, the 100 to 150 ml oil at a time will be used. Vessel 200 ml capacity to make the oil warm. Tissue paper or soft towel to clean the body of the patient. Green gram powder or medicated snana churna or medicated soap can be used to wash the body after massage, or mostly if it is a skin disease patient, we go for the Siddharthaka churna or Siddharthaka snana churna for powder massage or snana. Masseurs, 2 for the whole body, we need 2 masseurs, 1 for ekanga if only single part is involved, and 1 for the children below 10 years. So this is the therapist or masseurs. Pre-operative procedure, the choice of oil depends on the climate, prakriti and the patient's health condition. Of course, this is the part where the uniqueness of Ayurveda treatment is involved, because going to any spa center or any Ayurveda practitioner who are not trained well in the therapeutic procedures of Abhyanga, they will do that, they won't have the special choice for the oil. But if the super specialty with Panchakarma, he will have always the special choice for the special condition. So this is the choice of oil is very important, because this oil will, in the next slide we will see how the plain Abhyanga also will create the complication. So the choice of oil is very important in Panchakarma or in Abhyanga. The oil should be heated to a temperature of 38 to 44 degree according to the temperature of the particular time. As it is a cold season, we need to make oil more hot or more warm. It might be take 42 to 43 degree in the cold season, but in the summer season we just need 38 to 39 degree Celsius of hotness in the oil. Lukewarm oil is used for the Shirobhyanga. Of course, the oil which we use for the head should be less temperature than the body where we use the Abhyanga. So for head massage we use mild warm oil. Procedure, the patient should be seated on the droni or dhara table with his legs extended. Lukewarm oil is applied first on the head, starting from the anterior fontanelle and then covering the entire scalp. Abhyanga begin with the Karnabhyanga, ear massage, followed by the palms and Padabhyanga and the foot massage. two therapists apply oil uniformly on the both sides with the synchronized manner. The direction of Abhyanga. The Abhyanga employs various techniques such as kneading, rubbing, tapping and squeezing, that is Mardanam, Ardhanam, Marshanam, Sparshanam, Champaranam, Kampanam, Ladanam, Pedanam. These are different different techniques of Abhyanga which is told in Ayurveda. For optimal result, it is essential to follow a specific direction during the massage. The patient should lie supine on the massage table. The massage of a head, neck and face is performed with the patient seated. Routinely Abhyanga procedures done in the 7 positions that we will see. The massage should start from the soles of the feet and progress towards the heart, aiding the circulation of impure blood back to the heart. In case of neurological disorders, massage should be applied from the central to peripheral regions, usually following the direction of hair growth. Abhyanga can be done in sitting, supine, right lateral, left lateral, or in the some cases the prone position also, where it is applicable or where it is applicable. The mild spinal massage is given when the patient is in the prone position. The oil should be wiped off the body with the tissue paper or towel at the end of the procedure. So, mostly the duration of Abhyanga is last from 45 to 60 minutes according to the how many therapists are involved in the massage. If there are 4 therapists involved at a time, it will finish within 45 minutes or before 45 minutes. If only 2 therapists are involved, it may take more than almost 60 minutes also. If the patient weight is more than 100 kg, then it may take more time also. So, it depends on the each part of body should massage for more than 5 minutes. That is the ideal law of massage or Abhyanga. Post-operative procedure of Abhyanga. After Abhyanga, the patient should rest comfortably for 15 minutes. The patient can take bath in lukewarm water with suitable medicated soap or Snana Churna after 45 minutes. Rasnadi Churna can be applied to the head, that is dry talam. After the bath, the patient can consume a light meal based on their illness, digestive power and satma. Like mostly we advise the khichdi in this part of India, and in south part of India they advise the kanni or peya. If Svedana is indicated, it should be performed immediately after Abhyanga before bathing. When we are planning for the Panchakarma or major Shodhana and we plan Abhyanga before that. So, just after Abhyanga, patient is advised to undergo the Svedana procedure or fermentation also. And when we are doing only Abhyanga as a therapeutic procedure, then there is no need of the Svedana. When the patient feels appetite, he can take the light food according to the illness, digestive power or satma or suitability. Benefits of Ayurvedic massage. The massage positively influences the immune system, promoting physical, mental and spiritual well-being. Abhyanga can stimulate the production of white blood cells and antibodies, boosting resistance against viruses and diseases. It fortifies the musculoskeletal system, enhances blood circulation and facilitates nerve conduction. Abhyanga alleviates heaviness and stiffness, resulting in a lighter body sensation. Whether for maintaining health or treating illness, Abhyanga is instrumental in attaining comprehensive well-being. Mostly we use as a therapeutic procedure, we use in the treating illness, but in many culture, in Maharashtrian culture also, we use Abhyanga for the maintaining the health. Routinely in Diwali festival, we usually for the 5 days, we in the morning family have the tradition to do the whole Abhyanga of each and every person who is there in the festival season in the home. The padabhyanga, it's a part of abhyanga only, but when we do it for the pada or for the foot, it's known as a padabhyanga. The application of oil to the foot followed by the massage is popularly known as foot massage or padabhyanga. Feet are very important part in our body as many nerves from many organs terminates it in the feet. So, massage helps to strengthen these nerves and restore the health to many parts of the body. The vital points, that is gulfa marama or massage, which gives balance to your dosha and it's very helpful for people with insomnia, fatigue and cramps. So, in foot massage or padabhyanga swiftly alleviates the discomfort of leg, roughness, stiffness and dryness, fatigue and the numbness. Usually in our culture also, if anybody traveled a long distance or if anybody traveled to the foreign or wherever, or a 12-hour journey also, if someone comes in home after 12-hour journey, we usually ask or advise him to take the foot massage, so that nurtures supple, robust and well balanced leg with enhancing visual clarity. This practice effectively regulates vata and is particularly beneficial for conditions like gridhrasi. Furthermore, it serves as a preventive measure against the leg cracks and the constriction of blood vessels and nerves in the leg. In text also, Sushruta also says that foot massage is always beneficial as it induces sleep, brings comfort to the body, alleviates the eye strain and relieves the fatigue. That is why it is very important. Those who are working more time on the computers, or those who are watching more time TV or reading, or having reading books or doing mental strain with any electronic gadgets, they should at least do padabhyanga daily in the night before sleep. So, in textual, these are the textual indications of Abhyanga. Abhyanga is advised in the Adharniya Vega, like in Mutra Vega Dharaniya, it is told to do the Abhyanga to give the relief due to Mutra Vega Dharana. In Mala Vega Dharana, in Shukra Vega Dharana and in Nidra Vega Dharana, like when the patient cannot sleep, he is more sleepy and he has to wake up due to some urgency or emergency. So, to avoid the complications of not sleeping in the proper time, he should go for the Abhyanga. Shukra Vega Dharana, a patient withhold the Shukra Vega or Simane Vega, there he should undergo the Abhyanga procedure as a therapeutic procedure. In Pittaj Gulma also, in Charak Chikitsa 5th chapter, it is written like Abhyanga is the indication for the Pittaj Gulma complication. In Apasmara also, Abhyanga is told for the as a treatment. In scorpion bite also, Abhyanga is a treatment for the scorpion bite. Vatajrudroga, Vatodara and in Atiyoga of Vamana also, the Abhyanga is a treatment. Coming to the clinical indications, of course, in the healthy, like when baby borns, we usually do the first thing what we are doing is the Abhyanga to the baby. For at least for 6 years, it is mandatory to do the Abhyanga of that baby, because to give the strength or immunity in the whole further 60 years or 100 years. So, that is the from the birth we start the Abhyanga to maintain the health. And for the deceased, of course, there are the specific diseases where Abhyanga is advisable as a therapeutic procedure. And in Panchakarma, wherever Svedana is indicated or wherever Shodhana is indicated, without Abhyanga, it is not advisable to do the Svedana. So, it is the preoperative for Svedana and Shodhana also, for Vamana, Virechana and Basti or Nasa also, we do the Abhyanga as a preoperative procedure. Who excessively indulge in the alcohol, exercise, mental stress and sex, for them Abhyanga is the therapeutic procedure. For the old age, children, debilitated diseases or the patient who are emaciated because of the disease, these are the indications of Abhyanga. Of course, as it's a clinical, it's a therapeutic procedure, there are the contraindications also, which a spa person or the dai or the person who are not trained in Panchakarma, they might be not knowing that there are the contraindications of Abhyanga also. It is written like Kafagrasta Kruta Sanshuddha Ajirna Bhihi. It is a contraindication for Abhyanga. Kevala Samadosheshu na Kathanchana Yojayet. Before that, we should understand what is the Samadosha, what is the presentation of Samadosha, where Abhyanga is contraindicated. Tarunajvari, we should know the kind of, we should able to diagnose what is the Tarunajvara, what is the Jirnajvara, where Abhyanga is contraindicated. Virikto Vantasya Nirudo, those who have undergone Virechana, Vamana or Nirudha is contraindicated for Abhyanga, or those who are having Agnimandya, or those who are having, who are suffering with the disease of excessive nutrition or Santarpanotta Vikara, these all are the contraindication of Abhyanga, like those who are having Kapha predominant disease, those who have undergone the Vamana Virechana or Niruha, those who are suffering from indigestion, those having Samadosha or Tarunajvara, these all are the contraindications of Abhyanga. Then in text it has clearly written like when Abhyanga reaches to the deeper dhatu, it is written like when we do the Abhyanga in 95 seconds or 300 matra, it reaches to the external skin or romanta. In 400 matra or 127 seconds, it reaches to the tvak or skin. In 500 matra, it reaches to the rakta or blood. In 600 matra or 190 seconds, it reaches to the mamsa or muscles. In 700 matra, it may reaches to the meda or fat. In 800 matra, it reaches to the bones or bony tissues, that is 254 seconds, and in 900 matras it reaches to the majja or bone marrow. So, applies of Abhyanga, Abhyanga should be done after proper pachana only. It is most important. If the proper pachana is not done and Abhyanga is done, it induces the complication in the patient. Of course, the proper pachana is not only the internal medicine, many times the patient, the tongue is the mirror of our GIT. So, just before planning the Abhyanga, assess the tongue examination. If there is a Niramavastha, then only we should advise the Abhyanga. So, internal and external Rukshana is necessary. It is in Ashtanga Hridaya, it is written like Mamsala Medura Bhuri Shleshmanaha, Mamsala Medura Bhuri Shleshmanaha, Sneho Shitasya Tan Purvam Rukshayat Tatha. So, those who are undergoing Snehana or undergoing any Snehana procedure, they have to do the Rukshana properly first. So, he has given like Udvartana for Kapha Medo Vilayana. So, Udvartana can be done externally before Abhyanga to get better result, or internally Pachana with Chitrakadi or Ambvatari Churna or Shadharan Churna, Lavan Bhaskar Churna, Shivakshar Pachan Churna, according to the condition of the patient or Prakriti of the patient, can be done to get the better result, because doing Abhyanga in Amavastha is the blunder mistake by the physicians. It should not be done. So, proper assessment of Niramavastha and internal and external Rukshana is must essential. It may be used for the Upashaya and Anupashaya of the disease like Amavata. Of course, if we are doing the Rukshana and we are not sure about what is the condition of the disease, so simple Abhyanga to the one joint can be used for the Upashaya and Upashaya also. With the usually we do Prothandavadi Taila Abhyanga in Amavastha, and if patient says next day the pain increase, so that means the Amavastha is there. So, again we continue the same Rukshana treatment. So, Abhyanga can be used for Upashaya and Upashaya also. Abhyanga in proper Niramavastha acts as an essential treatment for mostly Vata ailment or many Vata ailments. The choice of Sneha is most essential in the clinical practice. If the patient is mean for the complexion increase in the complexion, we may ask the, or we may advise the Kumkumadi Tailam, and if the patient is in need of the improvement in the complexion, but he is having mostly kapha pitta pradhanta, we will go for the Nalpamradi Tailam, and if the same patient having kapha pradhanta, we will go for the Eladikira Tailam. So the same hetu of the patient, or we need the same action, but as the patient's prakriti is different or the dosha predominance is different, the choice of the oil changes, or sometimes we use the Kera Tailam or simple Tailam, Jatyadi Tailam or Jatyadi Kera Tailam. When there is a more pitta predominance, we go for the Kera Tailam, and if there is Vata is more involved, we will go for the plain Tailam or Jatyadi Tailam, which is medicated with the Tila Taila. So this choice of Sneha is most important in the practice of Abhyanga. With this, thank you all.